Hello, professors. It is Abby Kelly here. My sister's recording at home, that's why I don't have a mask on. I'm gonna go ahead and get started now. So the first thing I'm gonna do is I'm gonna wash my hands, and then I'm gonna come over here, and we're gonna check the MAR for Anna Powolowski. Her date of birth is 10/06/1957, and her allergies is penicillin. Then I'm gonna go ahead and scroll down and see what is ordered for her. It looks like I have oxycodone. It's gonna be 10 milligrams every 12 hours at 0900 when we're getting it. The route is gonna be oral, and it's in a tablet form. And we also have for Anna Powolowski, date of birth 10/06/1957, allergies penicillin. We also have diazepam, which is 2 milligrams every 12 hours at 0900. The route is orally, and it's in a tablet form. We're just gonna double check though and put us against my provider's orders. So, Anna Powolowski, date of birth 10/06/1957, allergies penicillin. For diazepam, it's 2 milligrams, great, 0900. The route is oral, and it's in a tablet form. That's good. Back up to the top for Anna Powolowski, 10/06/1957, allergies penicillin. We're checking this time for oxycodone. There it is, 10 milligrams, 12 hours, 100, oral, tablet. Perfect. Okay, so those line up. So now that I've checked that, I'm gonna go ahead and grab and retrieve them from my little retrieved. Okay, now we're gonna do my first check. So the first check is Anna Powolowski. We're gonna do oxycodone first. So oxycodone is 10 milligrams every 12 hours. We're gonna do it at 0900. The route is gonna be orally. It's gonna be in tablet form. Back up to the top, my patient is Anna Powolowski. This time for diazepam, we are gonna do 2 milligrams every 12 hours, 0900 orally, and it's in the tablet form, and that all lines up. All right, good. Now I'm gonna check the expiration date. So we have 10/31/2020 and 10/31/2020. Now I'm gonna look up what I need to know about my drugs. So for diazepam, we have, this one, the diazepam is for the anxiety. And it's gonna, the most common side effects are dizziness, drowsiness, lethargy. Most serious side effects is respiratory depression. We're gonna make sure we monitor the blood pressure, the pulse, respiratory rate, and periodically throughout and before giving this. It has a reversal agent, and we also need to know that prolonged high-dose therapy may lead to physiological or physical dependence. Restrict amount of drug available to a patient. Observe depressed patients closely for suicidal tendencies. And then for my oxycodone, we have that it is for her pain, and its most common side effects are confusion, sedation, constipation. Most serious side effects are respiratory depression. We're gonna assess the pain prior to giving it, and then we're gonna assess blood pressure, pulse, respirations. Also, this is an opioid. So we're going to assess for risk of opioid addiction, abuse, or misuse prior to giving it. Now I'm gonna do my second check to make sure these are the right drugs. So up at the top, I have Anna Powolowski, and then I'm gonna come down to oxycodone. 10 milligrams every 12 hours. We're gonna do it at 0900. The route is orally, and it's in a tablet form. That lines up with this. Everything looks good. Okay, back up to the top. We're gonna do Anna Powolowski for diazepam. If I can find it. 2 milligrams every 12 hours, 0900 orally. It's in a tablet form, and that lines up with this. Okay, and then I'm gonna gather my supplies, make sure I have everything. So I have my cup full of water, a little medicine cup. I have my medicine with me. And I think that we're good to go in the room now, so I'm gonna knock and wash my hands. Hello, my name is Abby. I'm a student nurse today. Can I just please have your name and date of birth?
Anna Powolowski, 10/06/1957.
Awesome, so I see that on your band, and I'm gonna check in here really quick. Yep, that lines up, okay. And then do you have any allergies to be aware of?
I'm allergic to penicillin.
Okay, and what happens when penicillin, what's your reaction to penicillin?
Rashes.
All right, so I have penicillin on here on your band. And it looks like I have that in here. Okay, so make sure you get no penicillin. I'm gonna be giving you 9 o'clock meds today. Do you have any questions about that?
Nope.
All right, so we're just gonna check the safety of the environment. So my bed's in the lowest position, my rails are up, you have your call light, the wheel's locked, there's no clutter, and then if you can, we're gonna sit you up to take that medicine, okay?
Okay.
All right, any questions or anything before I start?
Nope.
Okay, then we're gonna go ahead and close the curtain for that privacy. I'm gonna do my assessments that I need to do on you. So my assessments were blood pressure, pulse, respiratory rate, pain, and checking for opioid addiction. All of these are expected findings, so we're good to go on to the next part. Let me just teach you about your medicine really quick, okay? So I have diazepam for you. It comes in 2 milligrams, and this is gonna be for your anxiety, all right? And then I have oxycodone for you. It comes in 10 milligrams, and that one's gonna be for your pain, all right?
Okay.
Any questions about that?
Nope.
All right, so I'm gonna go ahead and I'm gonna do my third check really quick. So I have Anna Pawlowski. We're gonna scroll down to oxycodone. Good, 10 milligrams every 12 hours. We're giving it at 0900. The route is orally, a tablet, oxycodone. Okay, everything lines up. Then we're gonna do our next one. Back up to the top, we have Anna Pawlowski. Find our diazepam. Diazepam. Okay, 2 milligrams every 12 hours. We're gonna get this at 0900. Route is orally, tablet form. And there's no calculations needed because these are coming in the exact form that they're needed in. So no calculations are needed for this. I'm gonna go ahead and put them in this cup for you. Miss Anna, can you take both medicines at the same time in one cup?
Yes.
All right, awesome. So we're gonna do that then. Putting this diazepam in there, making sure not to touch it. And then oxycodone in there, also making sure not to touch it with our hands. If I can get it out. So that would have not worked. It has to go right into the cup. I can't touch it on any surface. It has to go right into the cup. I'm gonna grab this. I'm gonna let Miss Anna hold her medicine herself. And here's some water for you to take your medicine. All right, so then she takes it. Can I just see that you've taken that medicine? Open your mouth for me. Great, all right. And I'm gonna get rid of this clutter for you. All right, Miss Anna, I'm gonna document this in here that I would give you your medicine. So we're gonna go down to oxycodone. We're gonna update the chart because there's no scanner available. It was given, the dose for oxycodone was 10 milligrams. And it was given at 0900. Which it says right here. Okay, perfect. So we're gonna update the chart. And then I'm gonna go find my diazepam. Because there's no scanner available, we're gonna update the chart. So the dose was 2 milligrams. And it was given at 0900. Update the chart. All right, so that is documented, and I'm also going to document any assessments that I did on Anna Pawlowski inside here. I'm going to go back over here. Are you sitting comfortably? Everything good for you?
Yep.
Perfect. Can I get you anything?
No, thank you.
All right, so we're just going to check the safety again. So the bed rails are up. We're in the lowest position. It's locked. There's no clutter. You have your call light. All right, everything good?
Yep.
Okay, then I'm going to open up this curtain. I'm going to wash my hands.